Welcome to Inside Aesthetics, the world's leading podcast for injectors and aesthetic businesses. I'm Dr. Jake Sloan, an aesthetic doctor with over 16 years experience in facial aesthetics.
And I'm David Siegel, an entrepreneur and business mentor with over 20 years of experience in our industry. Our podcasts are aimed at industry professionals, and any information or advice given is general in nature. You should consult with a healthcare provider before undergoing any treatment.
You can also subscribe to us on Patreon for on-demand content for injectable and business education. Hey, buddy. This is the second time you've seen me today.
Yes, we had lunch.
For you.
It was good, actually. Lunch was great. We had lunch with one of our good friends and colleagues, Dr. Iman Nerlin from Sweden.
From Sweden, yes. And our guest today is from Sweden. So how about that? Two Swedes in one day.
It's Swedish Day.
Yeah, it was really nice. We went to the Gidley, if you've ever been there, in Sydney, which is great steak and kind of... I don't know, how do you describe it?
Yeah, it's just a
simple but really good food.
Yeah, great. They take your phone off you so you're not scrolling through social media and getting distracted. There was a couple of times we're having the conversation where we talked about a whole range of topics and we wanted to just...
We both went to reach to our phone and we couldn't because they took our phones off us.
Yeah, exactly. So we've kind of don't realise how often we rely on them for information. But it was good. Good experience, and shout out to Iman. By the time you hear this, you're probably back in Sweden, but lovely to meet you in person and coming to join us for lunch. And you were here for A24 this week, and you were there just recently in the last few days as well.
I was. So big conference. Thank you to Stephen Liu and the organisers again. Really good conference. As with all of these events, it's pretty, heavy on the education, long days, long nights, lots of socialising, but good fun.
Yeah.
And, it'd be good if IA could get involved next year. Maybe we did our live podcast last year, which was pretty cool.
Yeah, that was.
It's nice to see Iman and obviously colleagues from around the world who you don't get to catch up with often. And what about yourself? What did you get up to this weekend?
Oh, this weekend, a lot of family stuff. My grandfather's just moved into a temporary respite centre near my house. My mum's gone away on a health retreat for a couple of weeks, so helping him get settled and moved in, and lots of moving parts of the family at the moment. Had a couple of client consults on Saturday. Saturday is a good day for clients to talk to me because they're not injecting.
Nice.
So it's a good opportunity to catch up. Just a bit of stuff around the house, nothing too interesting. Life admin. I'm sure everyone listening to this can empathise with life admin. You just emails, bills to pay. It's just sometimes if you don't do it for a little while, then you just actually feel too overwhelmed to start, and then you come back to this pile of action points that you need to do. It's just...
Absolutely.
Yeah.
Now, if you're new to the podcast and you're one of our guests' followers who have never listened to IA before, we also do something called Patreon. So Patreon's an app that you can download. It's free to download. And then if you search for Inside Aesthetics and subscribe, we've got a whole bunch of educational material. I do all the injecting stuff. David, of course, does all the business stuff. We've got a lot of really interesting sort of niche stuff that you might not find on YouTube or even on Rebecca's Instagram. We try and sort of touch on stuff that others aren't doing. And we've got really good feedback. And we also host 8 differently themed WhatsApp groups where you can get 24/7 support and help and regenerative medicine conversations, and it's all happening.
Yeah.
So if you want more education and more support, check out our Patreon.
Yeah. Thank you. And what have you done for Patreon this week? I suppose it's been a bit tough for you with all the conference stuff going on.
Well, actually, Iman came to visit me in my clinic on Tuesday.
Excellent.
And she did my upper face Botox, so that was exciting.
Right.
So we thought we'd record it. We spoke about a bit of anatomy, dosing for men, maybe different patterns for men. Mild asymmetries that I have, that kind of stuff that, just, I guess, looking at a real patient rather than the cookie cutter approach that you sometimes see.
Yeah. Okay. Yeah. Very good. I've actually got one of our patrons who's coming to record with me later this week and just talking about her business. I don't know what we're going to be talking about yet, but this is something I do with our patrons from time to time, is get them to send me a message about something they want to discuss with their business, a challenge they're having. If they want to share a success story, maybe they can teach us something, because I'm learning all the time. That's one of the things you learn about this crazy world of business, is that the more you learn, the more you realize you have no idea. So that's going to be interesting. So I love these problem-solving little discussions, and I think the patrons that listen to it get a lot out of it because they're real-life scenarios, listening to a live coaching session. So I think it provides a lot of insights for people. So that's coming up this week as well.
100%. Now, let's introduce our special guest of the week. It's Dr. Rebecka Gardell. Now, I want you to do your introduction on Instagram where you introduce yourself on your posts. Let's capture that.
Hi, my name is Rebecka Gardell. I'm a medical doctor and specialized in aesthetic medicine.
There we go. The people were waiting for that one. Now, Rebecka, thank you for joining us. You're all the way from Stockholm, Sweden. So we've been following you on Instagram. Everyone's been following you on Instagram. It's sort of gone crazy for you. Tell us a bit about your background. How did it all start for you, and what sort of doctor did you start as before you became an injector of toxins into people's faces?
Yeah, well, nowadays I have 2 aesthetic clinics in Stockholm. I have, I think, 9 injectors full-time and a few others part-time, 4 admin staff, and then some other employees on maternity leave as well. But yeah, it took me a good few years. I opened my clinic in 2019, so it's 6 years ago. No, how much? 5 years ago. And yeah, it was actually exactly 5 years ago I opened my own clinic. But I've been working with aesthetics since 2016. So before that, I graduated medicine 2011. And then I started, of course, I did my internship, but then I started working with general medicine or family medicine. And I liked it. It was nice. That was going to be my future because I was starting to have kids, and I wanted something that was compatible with having a family, like more not having to spend nights and on the hospital and stuff. Then I heard from colleagues and from around that you could take these courses in Botox, and as soon as I heard it, I was like, maybe this could be something for me as a sidekick. So when I was pregnant with my second daughter, I took a course. So I went to a course with a local doctor here in Stockholm. And then, I started injecting at home, actually, when my second daughter was small. And then I did that for maybe 2 years. Like, I worked as a doctor when she started daycare, and then I still did it in my spare time. After that, I rented a room in a beauty spa 1 day per week. So I started doing 1 day per week. And then at the same time, I started my Instagram. And I pretty soon understood that, okay, Instagram is, a way to build your business.
Yeah.
So I started reading up about it a lot. I read articles about Instagram. I think this was 2017, something like that. And I understood that, okay, this is something that I can do probably. So I read an article where they said, of course, the algorithm has changed a lot since, but it said that you should post once per day. And I took a decision then and there and was like, okay, from now on, I'm going to post once per day, no matter what. And I started doing that. Of course, it was very slow in the beginning, but then I started to get more and more attention. And then I started to do it 2 times per week. So 2 days per week, I worked with aesthetics and then still working as a doctor. And then when my 2 days per week were completely fully booked, I felt like, okay, I do have some clients now that can fill, because there was a lot of pressure on these 2 days that I had, the slots that I had open. And then I took the step to open my own clinic full time. And pretty soon, I think the first weeks, it was a bit empty, but after maybe, 3-4 weeks, the schedule started to be completely full. And that's the power of social media, because I could reach out to a lot of new clients through that. And then the second big step for me, I would say, was to hire the second injector. That was pros and cons. I was very scared to do it. But then finally, I think after 8 months, because the pressure was so high, I hired another one. And then it's been like that, more and more and more employees that I hired. But I've always believed, I'm not a person who likes to take a lot of risks. So for me, it was very important to have an organic growth, a growth that was real, that was based on quality, that was based on, I know that Instagram can be risky because you can promise a lot and then you can't deliver. No, for me, it's been extremely important to deliver quality. The real stuff, it doesn't happen on Instagram, happens in the clinic, in my treatment room. So the people that I've had since, they are still coming back. So most of my clients, they keep coming back because I truly believe in quality and transparency. And that's very, very important for me.
And what was the strategy? So other than posting once a day on a continual basis, being consistent with that, what were you actually formulating in your mind in terms of what you were going to discuss or what you were going to record for your posts? Because a lot of people listening to this will be thinking, okay, well, what do I say? How do I find my voice? How do I actually put out content that's actually original for me? Because you see a lot of people that put up content and it's kind of like just regurgitated content, but in a slightly different way. It's like everything kind of feels the same. So what was your strategy?
Well, it's not that easy, to be honest. Like when I started, it was much more easy because you didn't have the video format on Instagram. This is new. So it was mostly before and after pictures. And I developed like a method to do that, like, to really post good. It was like my husband helped me a lot, or my husband to be, he helped me a lot with that, like only to post quality. Like I would post a picture and he said, no, that's too bad. Take it down, like take something else. Only post something that is really, really good. And but then Instagram algorithm changed a lot. So it was more and more leaning towards the video format. And then so that's also the thing with social media. You need to be very, what you call it, like changeable. You need to be dynamic and to be able to change, because the algorithm, like Instagram today, is not what it was 6 months ago. It's completely different. And 6 months from now, the Instagram algorithm is going to be different again. So it's important that because in my age group, it can sometimes be difficult. Like you learn something from the young people and then you stick to that. But the thing is, when you've learned it, it's turned into something else. So nowadays it's much more video content. And then I understood that I had to change. So just before and after pictures, it didn't do anything anymore. So then I started to record videos. But when I look at my first videos now, they look ridiculous. I was like speaking very slow and like so boring. And like, you know, you get like completely, it's almost intolerable to listen to.
It's like our old podcast, isn't it?
I had an idea that I should have like a before and after picture behind me, and I wanted to explain exactly how I thought, that what was the idea behind the treatment, how I was thinking, and how I performed it. But it was just unbearable to listen to. But at that time, like I think that was maybe 2 years ago, that was the way it was. But then it changed into a more fast and more rewarding way to speak. And so I tried to develop into that as well. But when it comes to subjects, I'm not that creative of a person, to be honest. Like I've never been good at thinking outside of the box. I'm very much like, I'm a proper, good girl, typical medical student, learning everything by heart. I'm all about thinking inside the box. I'm not so much thinking outside of the box. But sometimes, when you inject or you get just a thought, and then I just write it down. So I have like a notebook where I write all the ideas down. So when I'm about to record, I do have my ideas already done. So they pop up here and there. That's the way I do it. And because they're not long. So the actual core problem that I'm speaking about can be pretty small. It can be like, okay, what's the deal with this artery, or what's the deal with this specific treatment, or part of this treatment. So it doesn't have to be a lot of information, because in 1 minute or 1.5 minutes, they changed it now into 90 seconds on Instagram. You don't have time to say much. So the substance that you're actually saying is very, very little.
Can I put you on the spot and ask you just a difficult question that you might not know?
Yeah.
If you don't want to answer it, we can say pass. So in Australia, we've had all these laws that have just changed the way that medical practitioners can advertise and talk about what they do in terms of aesthetic treatments here in Australia. So we can't say anti-wrinkle, we can't say dermal filler. Before and after photos, potentially questionable in terms of how you do them. So my question to you, Rebecka, is, from what you've learned, I know you didn't start out as an Instagram expert, but based on the growth of your account and the quality of the engagement that you get, you're obviously doing something right. So if you were in Australia and you were starting your Instagram account, or you had to adapt your Instagram account, how would you approach being successful at Instagram if you were in the Australian environment?
Very difficult. I guess in Australia, you cannot post before and after.
No.
You cannot talk about Botox. You cannot talk about Botox at all.
You're not allowed to promote a drug, so in whatever form. So you can't do a video of you injecting it. You can't do a before and after. You can't show the bottle. You can't say the name.
Can you speak about theory behind it as a substance or no?
I would probably stay away from it, would be my advice, because someone will say, he's promoting this.
I would read up on the law. My husband to be, he's a lawyer, so I would make him read all about like what's possible and what's not possible.
Yeah.
And then I would, go into the gray zone, not the gray zone, but like try to go as far as I can.
Yeah.
But probably what I would do, I would talk a lot about theory, for example, take it a step back, talk about the theory behind. Yeah. I don't know. It's difficult. I know that the rules are there for a reason. And I think it's not completely wrong. I think there is a problematic thing that we are working with, obviously. And I'm sometimes struggling myself. Like, what am I doing? What am I promoting? Am I promoting people to doubt themselves or to feel like they have to change themselves? Yeah. And I'm open to my patients about this. Like, this is not a completely unproblematic business that I'm working with. But I think I would see exactly what is allowed, and I would stretch it as much as I could towards that border. For what is allowed.
Yes, so some of the ideas that sort of I've come up with and in conversations with my clients who are having the same kind of problems is, do we talk about the indications? Do we talk about the aging process? As you mentioned, Rebecka, theory.
Exactly.
Do we focus on skin because those treatments are not falling under the scheduled medication rules and regulations? Do we talk about, is regenerative medicine something that we want to start talking about? So these are some of the ideas that we've sort of been brainstorming, but I was just curious to see, because you're obviously so good at what you do.
Are you allowed, for example, to make a summary of a scientific publication, for example? I don't know if that's allowed. Like, it's just a summary of a scientific publication.
Well, yes, but as long as, again, you don't promote drugs. So if there's filler involved, it's going to be hard to talk about the paper or, a new toxin or something.
Is filler considered a registered drug in Australia? Or is it
is, because it's got lidocaine in it, and it's for, medical professionals only, which is good in terms of the public not injecting themselves and, crazy people not injecting themselves. But it falls under the law of you can't promote drugs. So again, it just makes it really difficult. I was actually going to focus on social media at the end, but we're in it now. So I'm going to ask you a bit.
You know how it goes, Jake. Yeah. All the rules go out the window as soon as the record button gets hit.
It's him. He turns the script upside down and he starts from the back and he goes forward. So that's my curveball. I don't know how to ask this, because the stuff that you do on Instagram is great. It's resonating. People love it. And of course, maybe your patients are even coming from it. But how do you feel about sort of teaching people effectively to inject through social media? I mean, some of it is very explicit, like do it here, this is my dose, etc. I mean, I get it, and I'm sure I've done it in the past. I mean, I can't remember, but I probably have. But I don't know. There's an ethical thing where you say, is this the right forum for it? What are your thoughts on that? Or do you think it could be better somewhere else?
It's difficult. I've heard that you discussed this in other podcasts as well, like in other sessions as well, episodes, sorry. But I know that it's a difficult issue. In terms of like the patients knowing what we're doing, I'm going to be honest, I don't think it's wrong. I believe in transparency. I've always done that. Like, everything should be in the open.
Yes.
I have a lot of people saying, like, why do you tell them how you do it? Like, it's just free education for everybody.
Yeah.
But I truly believe that, it's science and knowledge should always be accessible to everybody. That's my own belief.
Yes.
But can it be abused? Yeah. Sometimes I've actually had some issues with that, like, because I do sometimes inject, for example, lips behind the muscle. I do sometimes inject posterior temporal fossa. Those are areas that are more risky. I do inject forehead with filler. That is also a risky area. Nose. Do I want to promote maybe less experienced injectors to do this, which is pretty risky? And I've had some thoughts about that. Maybe that's not completely, good. But so I've tried to, like, okay, if I talk something about more risky procedures, I always do a disclaimer, like only for very experienced injectors, for example.
Yeah.
But I mean, it could be problematic, absolutely. But I think the philosophy that I have, that knowledge should be accessible. I think that tops it. I think that's more important.
Yeah.
I mean, many people say like you should have a Patreon and everything, but yeah, I don't know. I'm the same with my patients. Like I'm very, very transparent about good and bad things, about everything. Like if there is a treatment that I don't like, that I do, but I don't fully believe in, I will say that. I would never sell it in as, oh, this is great, do this and you're going to feel 20 years younger. No, absolutely not. You have some pros and you have some cons. Here you have the pros, here you have the cons. It is what it is. And it's the same with techniques, I think. I don't say that I have certain techniques that I use. There are good things about it, but there are also some techniques that I use that are more risky. And there are risks involved. Like, for example, if I go behind the muscle for lips, I can achieve more of a change in the shape of the lip, but that means that the risk of having an arterial bleed or even a vascular occlusion is a bit higher, and the patient needs to know this.
Yeah.
But of course, if I promote this a lot on Instagram, maybe someone who has worked maybe a year starts to try on his own, and it turns into a disaster. So I need to be responsible when it comes to that.
Yeah, it's a tricky one because, I mean, obviously what you're doing is resonating. You're getting thousands of likes per post and huge engagement and comments and people are loving it. But that suggests that they are kind of there to learn from you rather than just engage with you. And so my worry is that the, really junior ones who don't have that insight go, Rebecka did it. I'm going to have a crack at this. But that's on them. It's not necessarily you. That's on them.
I'm relying a lot on common sense.
The problem with common sense is it's not common. That's the problem.
I don't know. My client base, they are pretty, I don't know. I feel like even though they come and they see these amazing before and after pictures, if they have a lip, with a lot of projection or something, they understand that it's not possible to have but you have different demographics, you have different client, sections of the society and everything. But in Sweden, I believe that people like the client base that I have, they're pretty, logical when they think. So they can filter unrealistic stuff out as well.
It's hard, isn't it? I don't know if there's an absolute right or wrong. It's not like a binary, it's good or bad. I think on the balances of pros and cons, I think there's probably more pros than there are cons. You can't account for silly people that do silly things. It's like if people want to go online, they can probably find out how to make an atomic bomb or a gun. Like people can find, if people want to do something silly, they're going to find a way to do it. The only problem is though, it's not just them they're affecting, it's their patients. So then is that a regulatory issue? Is it like, I think that it's probably way more beneficial than it is a negative. So, but it's a discussion that it's come up, I think it's important for us to talk about it, but as long as you're making all those disclaimers saying, this is an advanced technique, do not try this unless you have, a high amount of experience or you're under the supervision of someone that's experienced who can help supervise you through this. Who knows, Rebecka, maybe this will be the start of you opening up your own teaching academy, or something in the future.
I've been having this on my to-do list to do online courses, but I just don't have time, but I really want to.
Yeah. So you sort of spoke about the fact that your patients are sensible, they're educated, which is great. Is that just a reflection of the Swedish people in general, or do you think that the content that you put out attracts that cohort or that group of patients with that mindset?
I would say it's a combination. We do have generally pretty high education levels in Sweden, but of course we have different, segments of society. But it's a mix, I would say. I love educating my patients before, because things like, what do I discuss with the patient when they come for a consultation? I discuss, okay, what do you want to achieve? But I also assess the area. What are you starting with? And when I assess an area of the face, one thing that is very important to look at is presence of old filler. Has the area ever been treated before? Number one. Number two, is this filler that they've had before, is it still there? Is it still in place? Or has it migrated to another tissue level or to another, location? And number three, after that, is this filler something that we are going to keep? Because the shape that you start with when you come, I'm not going to be able to remove that shape with more filler. I'm just going to be able to modify it or change it a little bit. But for example, if you have a certain degree of projection of the upper lip due to old filler, I'm not going to be able to make it flatter. So we have this discussion about removing, should I remove or not? And that is a difficult discussion to have. But since I've talked so much on Instagram before, the patient, when they come, they know that we're going to have this discussion. They know that, okay, I filled before there is a chance that I have to dissolve.
Yeah.
If I had a person that had loads of migrated filler and she has never even given it a thought, then it's more difficult. It's going to be news to her. Like, okay, can't you do the Instagram lips with this old filler? No, I'm not going to be able to do that. We have to dissolve first. And the dissolving process is very difficult. Yeah. You might have to dissolve 4 or 5 times until everything is gone. And it costs you more. So there are so many factors into this. And when the people come educated already, it makes my life much easier.
Yeah, that's how I used to use my Instagram. It was almost like a pre-consult, because they would see what you're talking about and then they've come and they say, hey, I saw you were talking about this on your post, and then you sort of continue that consult, I guess. But can't really do that as easily in Australia anymore. What's the breakdown of your followers? Like, are they mostly injectors? Are they mostly patients? A good mix? Like, have you looked at your business insights? Do you know? So it's useful to know.
My social media manager, she knows. We're not that advanced, but she does look in the insights every once in a while. But to be honest, we're not very good at that. But I think based on feeling only, I would say maybe, 20% are injectors. I do have a lot of injectors followers, a lot. And then a lot of patients as well. So it's a mix, but of course it's more patients, but I would say maybe ratio 80-20.
Yeah, because I think we've discussed it on the podcast before. Obviously, it's an amazing means of marketing, and you said it's been successful. But sometimes these people, I know that you get international patients flying in as well. The expectation can be, here, and obviously, if they've flown in, that there's a feeling from the injector's perspective, you've got to do something, even though it might not be the right thing. So it puts pressure on you, because you sort of get fairly unfiltered people. You don't know who they are. They're not necessarily from your locality. So how do you feel about that and sort of getting patients from international coming? Do you feel pressure? Have you had to turn people away despite flying?
Yeah, it's been something that I have to work with, but I do have, now I've gotten used to it. I do have probably 3 to 4 clients per week coming from other countries, or sometimes even more. Like in May, June, it's probably 5, 6 per week. Ooh. And they come, from, it's crazy. People come from all other side of the world to do lips only. That's amazing.
Well, have you asked them why they do that? It's interesting. Why? I mean, obviously your work's fantastic, but why?
Because they have gotten into their mind that the only person that is going to be able to create a shape that I want, the only person is that doctor in Sweden. And once you've decided that's the only person I'm going to trust, and then people put in the time and effort to reach me and to come to me, which is I have patients coming from Indonesia, from Buenos Aires. I have a returning client from Buenos Aires. I have from it's very, very far, and it's amazing. But with that said, we do have a very important written routine that we follow when it comes to international clients. Number one, it's very, very important that you will have an online consultation before, where we discuss, for example, presence of old filler, what is possible to achieve. I have a lot of clients coming for tear trough, from the States, from everywhere. And when it comes to tear trough is an area where it's very common that you need to do touch-ups afterwards or corrections. And I'm very open about that. So during this online consultation, we talk about what's the, conditions before the treatment, what's possible, what's not possible. I always lower the expectations a lot. And I tell them that if you come here, that means that you are probably going to have to, if it's for tear trough, you probably are going to have to come back for retouch. If you don't, it is possible to do a correction in your own country with a doctor that you trust. If you need a correction, you can send me pictures and I can tell them exactly what needs to be done. For example, you need to polish something down somewhere or add a few drops somewhere else. but we always prepare them for this process that they can come, but they know beforehand what is possible to achieve, and they know that they might have to come back for a retouch or to do a retouch in their own country after instruction from me.
Do you get them to book to stay for at least 48 hours after, just in case the rare situation of problem or even just severe swelling, you need to review them, or of course vascular occlusion or other, scary things? I mean, I've been in that situation, I probably don't have as many international patients as you, but people do come, and I always feel that pressure to somehow go the extra mile to ensure that they're going to be okay, because of course they're traveling sometimes hundreds of miles, if not thousands, and you want that duty of care after, and sometimes you can't easily provide that. So do you have any aftercare advice for those people traveling?
Yeah, so what I usually do, if it's a low risk area or a returning client that I've done, because I do a lot of my international clients, they come once a year for many years. Like they are definitely returning clients. And because they, when they trust someone, that's what they do. I tell, if it's a returning client, if it's a non-risky area, and if it's inside Europe, I tell them that they can fly home the same day. So I have clients coming from UK, for example, they come in the morning and then they go back in the afternoon. But if they're coming from far away and they're doing full face, I would definitely advise them to stay for at least 2, 3, 4 days after. Yeah. If it's tear trough and we're doing, for example, they're very deep and we need to put a little bit more product. I've had patients coming and they stay from the States and they stay maybe 4 days. If they can stay a week, work from here or do something else in the meantime, that's better, because then we can do after maybe I put them on a little bit of cortisone tablets the first day, and then swelling goes down faster. And then after 7 days, we can do a retouch before they go home. So that's one way to do it as well. It works pretty well.
So you've got 116,000 people following you. You said about 20% of those are probably injectors. So you've got,
I don't know.
Yeah, I'm just, okay, so a lot. You've got, let's call it thousands and thousands of people following you that are other injectors. So you're obviously a mentor to a lot of these people. They come to you for education and tips on how they should progress and develop their own career. So my question is, who were your role models? Who were the people that you looked up to? Who were the people that provided you with education and inspiration when you first started?
Yeah, so when I started, I went to this local Swedish doctor and I did a few courses with him. He was good. He was very knowledgeable. It was all sharp needle. But after these courses, he mentioned that cannula existed. This was in 2016. And I pretty soon after that felt like, okay, I want to use cannula because it feels, this feeling of nervousness that, maybe something is going to go wrong with this one. And with this one, you always have this, feeling that maybe something would go wrong, because it's if you're working by yourself, it's a very lonely work, and you're with this fear alone. So I pretty soon felt like, okay, I want to switch to cannula, and I started doing cannula, but it took a longer time. So when I wanted to do nasolabial, it was good, but it took longer time. So it did take me a year until I finally made the decision that, okay, I'm going to switch completely to cannula. So I think after 2 years, I stopped using a sharp needle totally stopped using sharp needle. I switched completely to cannula. So nowadays I never use sharp needle. The only thing I do with sharp needle is the Cupid's bow to lift it, but that's it. I don't touch the face with a sharp needle. But in those days, there weren't so many people using cannula. So I didn't really have anyone to look up to in that way. So to be honest, I wished I had a mentor, but I did most of the things myself. I did go to courses, but since most of the courses were not with cannula, I was like, it didn't do it for me. So my friends have been my scientific publications. Those are my friends. I've been reading, can you think about it this way? Okay, let's try it. So I know it's not the way you should do it, trial and error, but that has been my thing. Always analyzing tissues, always doing with one type of method, and then evaluating that, what was good, what was bad. Because I believe in transparency. So I'm always transparent and honest to myself as well. Was this good? no, this looked ugly, so I'm not going to do this anymore. Oh, maybe this way was very good. Okay, I'm going to continue to do that. So I've actually been pretty lonely in that. Like I wished I had a mentor, but I haven't. But of course, I have role models that I really admire. Like I have other injectors that I truly, truly admire. Like, for example, do you know her, Anusha from the States?
Yeah, of course we do. She's going to be having kittens because she loves you. So now you shouted her out. She's going to be very happy.
she's to be honest, I'm going to be completely honest. I really love that person because everything that she posts, I'm like, I would have done exactly the same. I love the shapes that she creates. And she has a term that she uses of the shape of the face that is upside down egg. That is exactly what I'm trying to achieve at all times. There is nothing I hate more than the wave shape. Mm-hmm. You know, the sunken in temple, the cheekbone, the sunken in area under the cheekbone, and then the jawline. I hate that. I don't like it. I like more of the oval shape or the upside down egg shape. And she has been like, it's been a very nice comfort to know that she believes the same things as me. And she's also an amazing person. So I really love her.
She is. She's great. She's been on the podcast.
Yeah, she has. She's part of our Patreon group. So, yeah.
Shout out to Anusha.
Yeah. When you said the oval shaped face, was that for male and female face? Or was that just female face?
No, I do. I always believe in soft transitions. But obviously, I wouldn't shape a male face the same way. But I do love working in the periphery of the face because I don't like the typical filler look. So, like, maybe a few years ago, it was more into having more of a mid face. I've stopped doing that. Like I still put filler in the mid face, of course, but not as much. So the amount should always be a little bit lower when you're going towards the center of the face. When you're in the periphery of the face, that's the opposite. I actually shove in quite a lot of filler in the periphery of the face because it, I'm not going to say that it lifts the face, but it definitely supports it and it gives it a nice natural shape. Because I've even analyzed my daughters, like how does the periphery of the face look when you're younger? It doesn't look the same as in a middle-aged person, on men and women. Of course, they do look different in men, but you still have more support here when you're a younger man than when you're aged. So I love placing filler here and I put quite high amounts there. But when it comes to like for men, for example, like on my husband I've actually done his. I've worked a little bit like with small amounts, like on men, because I would never ever want a man to look too done. If it's like a cis man, if you want the typical masculine look. So it depends on who's my client. But if you want a typical masculine look, I would see, okay, where have you lost volume in the periphery of the face? So a lot of it, like on my husband I've done a lot here, in front of the ear, and in the back of the jawline as well to support the face. And it gives very, very natural but rejuvenated look. So
just for the people who couldn't obviously see you, did you also say you did it sort of under the hairline, sort of under the temple?
So I know that this is a very controversial area, but I do love the posterior temporal fossa for filler. I really do. Yeah. I think that it gives very nice effects in men and women, of course, with lower amount in men, but it just removes, like it just changed the shape of the skull into a more youthful shape because you age there as well. Yeah. But there are risks with this area. There is a higher risk of vascular occlusion, but you can work in a way so that you test an area with a cannula, you go in and you secure it. So before you actually put in any filler. So I do have a lot of I've never had a vascular occlusion there. I do have a lot of arterial bleeds there, but I know that I haven't put any filler because I've always tested that area first. So then we know that this is just going to be a bump. It's going to go down. We pause the treatment and then we do it another time.
Yeah.
So that happens maybe in, I would say, 3 to 4% of the patients, I would say.
Yeah, just to say, if you're a listener and you're wondering, why is it controversial if you're sort of a new injector? There's a couple of cases of occlusions, like you said, and there's also a couple of published cases of alopecia from the pressure of the filler under the hair follicle. So it's just, it's a technique that, of course, has a place and a purpose, but think about what you're doing and your skill set before you do these things.
And what product are you using there, Rebecka?
Well, I love stiff fillers. So my favorite products in terms of stiff fillers are Toxin range, so TSL RHA4. I like Ultra Deep as well. That's a little bit stiffer than RHA4. I do love a filler also that everybody hates, which is, I don't know why, but I'm embarrassed to say it, but it's actually one of my favorite fillers. It's Revelax Sub-Q. Mm-hmm. Everybody loves to hate it. But I think that it's like in the UK, for example, it's been used by a lot of unlicensed injectors, but it's actually it's a Korean filler. It's really good. But what I like with my stiff filler, I want it to be able to lift, and I want it not to attract too much fluid. Those are my two criteria. RHA4 can sometimes be a little bit too soft. Ultra Deep is good though. So I use stiff fillers there. What was the question?
No, you just saying what filler in that part of the face. I think you've answered it well.
Yeah. So stiff, definitely stiff.
I got a question. Where are your parents from? Where's your ethnic background from?
So my mother is Swedish. My dad's family is from Israel.
Yeah, okay.
So we belong to the Palestinian minority in Israel. So I'm an Israeli citizen.
Yeah.
But I'm Palestinian in origin.
Leder behövligt.
Kent.
Yeah, okay.
Shalom. That's as much as you get from me.
I speak Arabic, but I used to go a lot there. Like my whole upbringing, I was my whole summers in Israel, so I did learn a little bit of Hebrew then, but mostly Arabic.
Oh, there you go.
The reason I asked is because you said that you prefer the sort of the lack of transitions and contours and temples and cheekbones. You like to have a smooth transition, and this is such a sort of a big sweeping statement, but that's often a taste in Middle Eastern women as well as Asian women. They prefer not to see concavities. So I assumed that you were Middle Eastern, but or at least part, but I didn't know, and I didn't know you're from Israel actually. Mm-hmm. But how do you feel that works on your Caucasian patients? Because often they want to see a sharp cheekbone and the submalar hollow. They think it's sexy. It's like the model look. So do you get requests sort of the other way to how you see a face from your Swedish patients?
Yes, of course. Like I have my own preferences, but I never think that my opinions are worth more than the person I have in front of me. So that's when I'm having the consultation, what my goal is to get to know that person. I try to get into their head. What is beautiful to them? Mm-hmm. And even though they want the filler look, I'm not going to say that I'm better. I know better. If they want that, if they truly want that, if it's a choice that they have, I will say, okay, I can do it for you. I can do the classical filler look. Fine by me. I mean, I'm not going to say that my way is better. No. But in my personal opinion, I don't think it's really nice. I do have also the people who want the model look, like they want a little bit of hollowness as well. So yeah, I can do that as well. I just fade less. Because fading is something I really love to do. And that's one of the reasons why I love using a cannula, because I can, fade the exact shapes that I want. I don't have to put in boluses. I can put most of the filler in the middle and then put less. So I can still create a visible cheekbone that has shadows underneath and above, but without creating too harsh of an angle.
Yeah.
So it's all about the angles. Like it can be an angle. You shouldn't make it too harsh. And you achieve that by fading the filler.
It's an interesting concept because there are a lot of injectors who are very definite about the type of aesthetics they want to create and will essentially say,
my way or the highway.
Maybe I'm not the injector for you because they want to be known for a certain aesthetic. They think they have almost carved out almost like a specialized aesthetic that is synonymous with them, and they feel like doing that. And then you've got injectors like yourself who are quite happy to adapt and request what the patient wants. Do you sometimes think, though, that patients really don't know what they need? They don't understand facial aesthetics like you do. They don't understand symmetry, proportions, what's appropriate for their ethnicity or their age. I'm just curious, not sort of a question for both of you, really. I just think it's an interesting point.
Rebecka can take it first and I'll add at the end.
It does happen, of course. And it happens where I don't understand the patient and the patient don't understand me. And then I just try to take it slow. I always see my relationship with my patients as a process. Even if I say that, I can see that you have some old filler here. For example, the nasolabial fat pad makes, maybe you've sometimes noticed that your face is a little bit swollen. For example, in pictures when you smile, maybe you can feel like it's a little bit, something is going on there. Have you felt that? So I put like a small seed the first time I meet them. And then maybe they come back it can be after months, it can be after a year, after we've done other things, like, oh, I know that you told me that maybe sometimes I feel swollen when I take pictures and I smile. And like, yeah, I've seen that. Okay, I can see that I do probably have some migration here from old, I've done my nasolabial folds 6 times in my life. There are loads of filler there because filler doesn't go away. So probably a little bit has migrated. Let's dissolve it because I want to be flat here. I don't want to be puffy here. So it can be something that I mention, but without judgment, without having any opinions about how they look. They look fine the way they are. But then after 2 years, they want to do it. So that's fine by me. I mean, I'm trying to be like, we have to be a little bit of like psychologists, like it's give and take. But what's most important for me is I treat them with respect. Everything is okay. There is nothing that is, better, more worth than others. Like I really believe in respecting your clients. That's very important to me.
What about you, Jay?
Yeah, I mean, I think that's really fair. I think what you're really saying is you do a really good consult and you understand your patient, their needs, their wants, and I'm sure you take photos and all the rest of it. So I've probably become less rigid as time has gone on. Not for any particular reason, but I just think it's easier to work with the patient like that. And you don't want to have not a fight, but you don't want to have that attrition where you say yes or you say no, and you don't really want that. But it's about educating your patient to maybe understand why you feel that way. I saw a post recently. I was just looking through doing research with Rebecka, and she said, I don't believe that we should be telling patients that they need filler, and if they want their lip done, they have to have their chin done. That's a common thing that injectors sort of put on their patients. And if I feel that they can take a smaller lip and get away with not doing the chin, I think that's a reasonable negotiation. Yeah. But of course, if I think they're going to look ridiculous, then I'll explain why in a kind way and educate them as best as I can. And maybe I will have to dig my heels in and say, not today. But once we've done a little bit of, proportionality, then sure, your lips are going to look awesome after. So I'll try and make it positive, not a no, if that makes sense. Do you agree, Rebecka? Is that a fair sort of summary?
Absolutely. Yeah, that's very good. I would do the same. Very good.
Okay, so we want to talk about your business, but maybe just a couple more questions about injecting before we talk about the stuff that I'm really interested in. What are you looking to, what's the next stage of your injecting career? Obviously, you're very experienced. You've got a good handle on what it is that you're doing. Is there any particular areas that you struggle with or areas you're looking to develop? I think it would be nice to sort of hear that someone even as advanced as you are still looking to, I guess, progress forward, or there's things that you struggle with, just to make us all feel human, potentially.
Of course. That's a difficult question. I do have my methods, but I'm always evolving. Like I, even now, I think I'm a better injector than I was a year ago. So it's, one thing that I would like to perfect the choice of fillers for lips, for example. Sometimes I think I've found the filler that I want to use for lips, like as a general that I go to choice, and that's Restylane. So I usually use Restylane Define for lips, and that's a little bit of a thicker product. It's not very thick because it can be too overwhelming with a very thick product in some clients. But I used, like this spring, I started using Restylane Kiss, and I really didn't like that product. It was too thin for me. It just migrated very fast. It just, went into droop down. But I would like to be able to choose the fillers more correctly when it comes to lips. So Restylane Define, I think, is a very promising type of filler that I'm going to start using a lot, or I am using it. I think it's working very well. Apart from that was a very difficult question. I don't know.
Sorry.
There are many things that I need to improve in, and many things. But I do, like, I work with clients, I think, at least 4 days per week, full time. So I do a lot of injections, and my schedule is crazy. So because I teach as well, but because I teach, it's very important for me to still inject a lot of patients, because how can I teach and be an expert if I don't inject all the time? Because I haven't been injecting for that many years. I'm very bad at math today. It's been 8 years. So, but I've been hearing on your show people who's been injecting for 20 years, and 8 years is nothing when you compare. So I still have loads of things to learn.
Yeah.
But I'm really liking the way that I work now. I feel like I do have the consultation, getting to know the patient, and then creating the soft angles and everything. I do get very, very, very nice results at the moment. It can change, but at the moment it's a good flow for me.
You've been injecting for 8 years. At what point did you kind of realize I'm good, I'm competent, and maybe I'm even ready to open my own clinic? Like, how did the penny drop? Like, what made you realize that you had that gift to inject people? Because, David mentors lots of people. I speak to lots of injectors, and sometimes it goes the other way. People can be injecting for years and they never quite feel confident. There's this underlying anxiety that something's going to go wrong and I'm going to blind someone today. And I see that quite commonly with people. So what was your sort of turning point?
I think that wasn't that long ago. Like, I think it was maybe, I've had the clinic for 5 years. I think it was maybe 3 years after I opened my clinic, where I could feel like, okay, I could feel the experience, make me very calm. It wasn't when I opened my own clinic. I was still like, I was experienced, but I didn't have that inner calm. But now when I'm used to having so many, clients that I can be nervous of treating, people from abroad, people who are, important clients. And now I feel this, calmness that, okay, like, even if something goes wrong, I will know why it's been wrong. Like, I know why it went wrong, and I know that I have a plan for it. And I know that I have explained to my patient beforehand that this can happen. So that gives me calmness. Like, this transparency that I'm working with, it also makes me more calm, because I know I've been telling the patient everything before. So, but it does take time. Like, I still, as I said, like, I still feel like I become better and better. Like, this year compared to last year, I feel better.
Yeah. And
in terms of technique injecting.
What conferences or events or trainings are you still interested in? Do you do anything regularly, or do you sort of pick and choose depending on, the year? Like, what do you find value with when you're trying to learn?
Yeah, I have one advice actually to give to other injectors, and that is to read a lot of scientific publications, because you have so much information there. Everybody, like, all these publications, you have all the knowledge, everything that you need to know. In terms of conferences, I haven't really went to a lot of conferences that are sponsored by different companies. I'm not saying that there is anything wrong with them, or like, but I've never myself had any connection to any of those companies. I wouldn't be against to do that in the future, but it's just hasn't been. I've always been very independent when it comes to those companies. But last year I went to Subio's Needle Art, if you know it, Dr. Subio in Philadelphia, and I spoke there. But that was actually an amazing conference. His philosophy was a little bit like no bullshit, and I really like that. So he has the same style as me. Like, it's all about transparency. It's all about talking for real, like what is good, what is bad, pros and cons. I love that way, like that atmosphere. That's the way I like it. And sometimes some conferences can be like, okay, it's very much same. I would want to go to more cadaver courses. I would love to go to Julie Bass, Head and Breakfast.
Yes.
I would really love to go to that, because she seems so knowledgeable. I went last year to Lee Walker, to his cadaver course. It was really good. But I would love to try hers as well. I think it's very important to go to cadaver courses regularly, because it gives you just a next level understanding of the anatomy. Even though you know everything in theory, just to see it and to feel it and to put your cannula in there and just see what like level you're at in terms of, like, I inject the way I used to and I can see exactly which tissue layer I'm in, and that's so important.
Yeah, I agree.
So.
It was interesting when you guys talking about how long it took you to feel comfortable. I was just looking at some numbers on my calculator. That I think I mentioned this in the podcast before. There's a book called Outliers by a gentleman called Malcolm Gladwell, and he talks about the concept of how long it takes to master a certain skill set, whether it be, playing a musical instrument or learning a language or something along those lines. And they said the bare minimum is 10,000 hours, really, to become competent, where you could consider yourself having a mastery of the skill set. But then there's all the artistic interpretations and developing as an artist, which I see what you guys do as a form of art. So if you sort of extrapolate that out, 10,000 hours, if you were to inject 7.5 hours a day, 5 days a week, it'd take you like 5.5 years to get to that point where you can say, I feel very proficient.
And let's be real, most people aren't fully booked in those 7 hours, and they might be doing basic tox for 5 of those 7 hours.
Yeah.
So it's probably double that, if not more.
Yeah, and there's a lot of varying factors, like what's the quality of the work you're actually doing.
Yeah.
And I kind of think if I look at all the people in the world that are like the best at what they do, whether it's like a Michael Jordan, for example, in basketball, or a Novak Djokovic, or someone that's just like the freak of nature, like the GOAT. You look at those people, and there's an obsession. Yeah, there's almost like an unhealthy obsession with wanting to become great, and I think that's probably what it takes. I think 99% of people on this earth are given relatively the same amount of mental capacity. There are people that are geniuses, and no matter what they do, they're just brilliant, right? And there are some people that just, unfortunately, for whatever reason, don't get it. Like, they just don't have that same aptitude. But for everyone else, I think it just depends on your level of dedication and obsession.
Yeah.
Yeah, it's crazy.
I agree 100% to that. I agree 100%. Everything, like, really. I tell them, like, when I hire a new injector in my clinic, I tell them it's all about time. You have to do X amount of treatments. After that, you are going to be good. You are going to be better. It takes time. And I think many injectors, they give up too early. You have to be persistent. And I think that's one of my good qualities in life. One of my daughters is exactly the same. We're just persistent. We just keep on going. And with injections, that's it. Like, you just have to do a lot of injections. After that, you are going to be good. Yeah.
Well, when you did take on I think you said your first nurse, did you say you've got more than one nurse?
She's got a team of 9.
Now I have 9, I think.
Oh, wow.
Nurses and doctors hired. Yeah.
Okay. So what do you do in your mentorship, and what do you expect from them to give back to you? I mean, how does that dynamic work? Do they pay initially, or do you just ask them to work? Like, how do you onboard someone, I guess, is my question.
I have chosen to only work with beginners. Like, I want them, like, when I hire someone, I prefer that they don't have any experience, or maybe just like a basic course, tops, because I want them to work with the exact same techniques as I am having. So preferably no experience at all. And so all of my injectors have gone to the courses that I hold, because I've been teaching since like before I opened my clinic. I think I had courses from 2018. I started doing like basic and advanced courses because I love to teach. But anyway, so they go to my courses, and then they stand with us to watch us as well, parallel to the courses. And then they start taking their own clients with someone standing with them, either me or any of our other injectors. So we have like a 2-month introduction program that they follow. So it's all like, we have the routine for that. After that, they're allowed to take clients, but the clients pay very little. So it's like a trial thingy. So I don't want the pressure to be too high. So we have a philosophy in my clinic that kindness is the most important, like, value word that we use. We should be kind to each other, and we have very soft values here, because I'm not like an authoritative person. I'm not that like strict. So everything is allowed. We're very, very nice. We've never had any drama here. So I truly believe in kindness. No sharp elbows, nothing like that. So they take their time. They can have 1 hour per treatment, 1.5 hour per treatment. I don't interfere, whatever they want. Because the first year, it's all about them. If they can start taking clients like a little bit after 6 months, then I'm going to be happy. What we do, basically, they don't pay for any courses. They get a salary from the beginning, a set salary. Lower the first 2 months when it's introduction, and then it's a little bit higher. And then after 1 year, I expect that they're going to start to go plus a little bit. So after that. But if they leave, we have like a thing that if they've gone to a lot of courses, they might have to pay parts of it if they leave after 2 months or 3 months, some stuff like that. So we have like a calculation. But of course, if they leave after a year, I'm going to be, losing. But that's a risk I have to take as an employer. Sorry. But...
sorry, I was going to say, be honest, because no one's listening. How many people have you had to get rid of because they were rubbish?
Not many, actually. I've had, a few.
And was it sort of a...
I had one. Actually, is this recording or?
Yeah, yes. I was only joking. Everyone's listening.
No, a few. Like sometimes, like for me, it's not about the injections. It's about like, for me, it's very important that they have the same philosophy as us. Like if you have someone coming in and trying to compete with everybody else, want to make themselves like, push down other people to make themselves better. That's something that doesn't work with us. We're all so kind people. Like I tell everybody here, like it's better to be pushed over by someone else than to be the one who pushes over another one. Like that's the way I want it. I like it like that because, as I said, we've never had a problem. We've never had drama. And that's the way I want my life. Like, I just want everybody to be kind to each other.
Yeah.
And it works pretty well. Like, we have a very, very good organization, actually. It's very efficient because I believe that if everybody's happy here, I have free food for everybody. They can eat whatever they want. We're very good as employers because I believe that it costs me a lot. If someone wants to quit, and I have to hire another one, it's going to cost me a lot. So if I'm kind to them, if we're being very nice to them and have these soft values, I will win in the end, I think.
That's very nice.
That's the way I believe, at least.
So when you're interviewing someone or you're recruiting for a role, obviously skills is not something you're looking at. So what are your criteria? How do you make the assessment that person is suitable for your team?
It's very difficult. We had like interviews a few months ago, and it's so difficult because we have my assistant, like one of my colleagues, who's like the manager here. She has a very good what you call it, like when you have a feeling that someone is good or bad, like a
gut feeling, intuition. Yes,
she has a very strong intuition. So every time when like me and my other colleagues have like felt like this person is really good and she has been against, it's never been good. She's like, I had a bad feeling from the beginning. But when she has a good feeling for someone, that person's going to be 100%. So to be honest, I let her decide most of the times. She has to say, okay, if she's not okay with that person, I'm not going to choose them.
So she's like the Oracle from the Matrix.
Exactly, definitely.
and are you hiring based on the team? Because one of the things I used to struggle with when I owned clinics, which I don't anymore, was just when I was interviewing someone, I was thinking to myself, how's this person going to work with everybody else? Like, what type of person is this? I know you like people who are very gentle in nature, kind, they're not pushy, like, these hungry people that are willing to eat everyone around them to get ahead. I know that's not what you're looking for, but are you sort of looking at how's this person going to fit? What do they bring to the team that I'm potentially missing? How are they going to get on with everybody else? So those thought processes go on in your mind?
Yeah, it's very important, of course. And those have been things that we've like had as a criteria. Like if someone are not going to continue with us, if they don't work with the group, it doesn't like, it has to be, because we have a very nice atmosphere. People are laughing together. Everybody are friends. It's a very good atmosphere. So yeah, obviously they have to fit into that.
Cool. Now I want to ask some injecting questions because we've done a lot of business in social media, and I'm an injector, so I've got some injecting questions. Is there anything that you, I guess, don't believe in? For example, threads have been a common thing on our podcast for a lot of people who've actually not sort of been impressed with the results of threads, whereas, a handful are. But is there anything that you sort of don't buy into, or a particular area that you don't like doing, anything like that?
Threads, I would say I still do them. They were very trendy a few years ago. I think the demand has gone down a lot for threads. They are still one of the few treatments that you can do that works inside the superficial fat pads, for example, the jowls or the nasolabial fat pad. So that's one thing. It's one of the few options that we do have that works on that tissue level. Mm-hmm. But when I have a discussion with my patient, I will say it's 50-50 if you're going to like it or not. I have loads of clients who don't see any difference. Is there something happening there? Well, probably, because you have some scientific publication, you have some histological slides where you can see the scar tissue forming. What is that scar tissue doing? The collagen that is forming? Probably something, but a lot of times it's not enough to motivate the time and effort and the actual, because I've done threads twice, it does hurt afterwards. So I would say I still have some clients that do these treatments maybe once per year because they really like them, but I would say 50-50. Like, there is a lot of clients that do it and they don't do it again.
Yeah, 50-50. That, for me, that's too much of an unknown, and that's a lot of potential pissed off patients or complaints or even asking for refunds. What do you think, David? Is that a good hit rate?
No, but I think it comes down to patient selection. I mean, I'm obviously, as I said, not medical, but people I've spoken to who do a lot of threads are very selective with their patients. Like, I've heard that Asian patients, for example, have different tissue. The tissue tends to hold the thread better. So is it a patient issue? Are we sort of thinking that every tool is applicable and going to be equally as beneficial for every patient?
Yeah,
probably not. So I think
I have a few clients who get really nice results from threads, and they do them regularly. I do, so they keep doing them, of course.
Cool. No, this isn't to bag threads. What about any risky areas that you just say no to, or do you do everything?
I actually do risky areas. I do have ultrasound. Which feels better. So I can always, check it before and see where the arteries are and all the vessels and everything.
Yeah.
But I do also, like, my main thing when I work with the risky areas is that I need to have a lot of time. Like, if I do forehead, for example, I do the treatment extremely slowly. Yeah. I would never treat a risky area the same way I would treat a more safer area. So I have a certain routine that I go after when I do risky areas. So if I would inject the forehead, I would go in, I would wait a little bit, go back in, put a few drops. Because how can you get a blindness if you do a forehead? That's if you push in too much product into all the way back to the branch of the ophthalmic artery, and then you can get blindness. If you push in so small, tiny droplets, even if you have a vascular occlusion, it's going to be local. So that's the way I'm working in risky areas. And if I go behind the muscle in the lip for the STA in the posterior temporal fossa, I will do it in a certain way. Nose the same. So I try to just be very, very careful in risky areas.
Yeah. What's your take on biostimulators? We must have spoken about this a million times, and it's sort of become trendy again to do less HA, more biostimulators. And then the question is, well, what's your favorite? And what do you actually think biostimulators are doing in the tissue? Because, we talk about collagen stimulation or elastin stimulation, but is that true, or is it just dumping down some scar tissue?
My personal experience is from Sculptra is that it's amazing. I love Sculptra.
So does he. We were talking about this today.
Bias. Sorry?
David does as well. We were talking about this over lunch.
Yeah, it's just, we haven't, like in Sweden, Sculptra had a very bad reputation for many years. So it wasn't that common in Sweden at all. We started doing Sculptra, I think it was around a year ago. So we haven't been doing it for a long time. But during this year, I would say I've seen so many nice results.
Yeah.
Like, I would say, I think I have one out of many, many, many clients that I have not seen any difference. Like one older lady in her 60s, she did twice. I didn't see any difference.
Yeah.
But apart from her, I would say all of the others, I myself have seen a difference. And also on myself. And what I liked mostly about the Sculptra was that, for example, when you put it in the double chin area, I feel like the skin here gets just sucked up a little bit. It gets glued into the underlying surface.
Yeah.
And that gluing process, I know that plastic surgeons, they don't like it. And of course, I tell my patients that they should stop if they're planning to do a facial, like a plastic surgery or a facelift. They have to stop it a few years before.
Yeah.
But for me, for example, I don't think I'm going to do a surgical lift. I'm 41 now, probably when I'm 50. So I can still do Sculptra for a good few years before I plan, like I have to stop before my facelift. So probably my face is going to be a total nightmare for my surgeon. Total nightmare because there's so much stuff in there. But yeah, so personally, I really like it. And scar tissue, collagen stimulation, yeah, I just see the results and it just looks amazing.
Yeah. So who do you think the best patient is for Sculptra? Like, who's the best candidate?
I would say, like people in my age group in their 40s is the best. Like if they're too old, obviously they're not going to have the same results. I've had a few clients that are above 70. They still like the results because they know what they're starting with. But I've done loads of clients in their 40s and 50s with good results.
Yeah.
Of course, it's not going to be instead of a surgery, obviously, but it's still like a lot of patients are not ready to do a facial, like a facelift yet. So
Yes.
Yeah.
Then it's good.
And what areas of the face? So are you using mid-face, temples? Like where are you using it and what depth are you putting it at?
Yeah, so I do it subdermal with a cannula. So I mix Sculptra with 10 mLs of fluid, so 8 mLs of sodium or saline and 2 mLs of lidocaine. And then I inject it here.
Temple,
here.
preauricular. And
Yeah, so temple, lateral part of the face, mid-face. So mostly in the periphery of the face first time, especially if they're hypertrophic. And then the second time I go more and more towards the center of the face and I do the chin area as well.
Yeah.
Okay, interesting. Yeah, I mean, if you're listening, just be careful. Those more movable areas can be more prone to lumps if you're not experienced or you're not diluted properly. So just be careful.
I expected to have lumps because that's what I've been hearing. But until now, obviously at some point it is going to happen. But until now, I have seen nothing.
Yeah.
And
strange.
Why choose that product versus, say, hyperdilute Radiesse or Alance, or there are other options? So why did you choose Sculptra?
So hyperdiluted Radiesse is also, I like it as well. The difference I would say between Sculptra and hyperdiluted Radiesse is that hyperdiluted Radiesse gives you swelling for a bit longer. So myself, I experienced that you are swollen for a bit longer, like at least a week, 14 days, something like that. A little bit higher risks of having lumps is my experience as well with my patients, like on chin, neck, for example, the thin tissue. So a little bit higher risk is what I say to my patients, but they're very comparable. Both of them have a good effect, but the convalescence or the healing process after Sculptra is much faster, I would say.
Yeah, it's interesting.
So you said that you do ultrasound, relatively new to your practice, I'm assuming. How are you using it? Are you using it for pre-screening patients? So, high-risk areas where, identifying sort of things like temporal artery, for example, complication management, and also what device are you using?
I'm using the mobile one. I think it's
The Clarius.
it's L20.
Yeah.
Had to check. It's L20 and Clarius. And I use it exactly like you said. It's been very useful because I do handle a lot of complications from other clinics. So we've had a few cases of really bad complications from other injectors. And then it's been like when it's been a few days and you don't know where it's been wandering off. So in those cases, it's extremely good. And it's also like a safety blanket. You feel more secure just having it there. But so I use it a lot, like to pre-scan an area or if we have complications, if we handle complications. And then But when it comes to finding old filler, I use it because we do have clients that want to check with ultrasound for old filler. But to be honest, like for me, sometimes it's more easy to just looking at a person together with the anamnesis, like the patient's story, and asking how many times have you done filler in this area, what amount, what type of filler have you dissolved at any time, and then you look at the area, and then you can see, for example, pictures of the person before they did any filler. Those methods are sometimes even easier to be able to see. But I'm not an expert on ultrasound, but I have used it to look for, especially to see what tissue layer it's in and stuff like that.
Have you found patients, and maybe it's the ones sort of flying from abroad or following you online, and you might have mentioned ultrasound, that they're almost coming with all of their eggs in one basket, that your ultrasound is going to cure them from whatever filler problem they have? I'm seeing that, and I'm sort of wary of how I talk about ultrasound these days, because the patients almost come like I'm their savior and I'm going to cure everything that happened in the past from their previous injectors. And I personally am not as experienced as some of these superstars on Instagram, and I don't promise that, but the patients still expect that. Are you seeing that?
Yes, absolutely. Like, for example, bad cases of malaredema where you don't know what has triggered the malaredema. Could be filler, but could be also be, Profilo or a traumatic experience triggering that, something that was going to come, but something just set it off. And then you don't know what you're looking for. You still have to take the patient's story to see how many times have you been injecting filler in this area? Where was it placed? Was it deep? Was it superficial? To find out what triggered this malaredema. Could it be hiding in the socket of the eye? You don't know where to look, and you don't know what set it off. So the anamnesis, like the story, the asking patients questions, that's the most important part, because you need to understand what set it off. So ultrasound is definitely not going to be able to solve all my problems, no.
Yeah. Now, we've spoken about your fillers and some of the ones that you like, but what about toxins? Like, which one do you use, or do you have a couple in your fridge, and why?
Yeah, so we carry both Dysport or Azalure, which is the name on the European market, and we carry Bocotur, which is Xeomin, I think.
Yeah.
I personally use Dysport or Azalure all of the time. I like it because I like the fact that it's a smaller amount that you inject. And I do feel like it's just a little bit more potent. Of course, it's dose dependent, depending on what brand you use. You can use a higher dose with the Xeomin as well. So, but it's just a personal preference. I like it more.
Yeah. And do you do the standard on-label reconstitution, or do you mix around with different dilutions? How do you prefer to use it?
I use mostly the standard, so 125 units with 0.63 mLs. But I do sometimes dilute it stronger. Sometimes if I do the masseter, if I'm scared that I'm going to have a spread, or if I do, for example, pretarsal Botox, then I dilute it stronger, anywhere where I really don't want it to spread. Or, for example, if I, for some reason, need to use a much higher dose, then I can dilute it stronger. And sometimes I dilute it with more fluid. For example, if I want to do forehead and I want to have, the sprinkle effect, a little bit of more floating around. I dilute it differently depending on area. But yeah.
Cool. And what do you think about these new toxins coming? Ones that last for over 6 months or shorter duration? Like, where do you see a place for that in your practice?
Yeah, I would love to try personally the longer lasting. I'm very excited to try it because on me, Tox it doesn't last for so long. So I would love to see if there is a true difference compared to a higher dose, upping the dose with a regular Botox or the Dysport. So I would love to see like a comparison to that. But I'm a little bit like, it's going to be much more expensive, right? So
you would imagine it doesn't make business sense to do less of the stuff and see people less.
I don't know how my clients are going to react if it's much more expensive, but I'm definitely excited to try. Okay. Absolutely.
Cool.
Gosh, I could ask you so many business questions, Rebecka, but we're probably not going to have enough time to follow them all, talk about them all in this conversation. So I guess if I had to sort of distill down what I'd like to know most about your business is, how have you done so well so quickly, and how have you acquired those skills to be able to run 9 clinicians? You said you've got some skin therapists as well. There's obviously some admin staff. You know, you've been injecting for 8 years, which is still a good amount of time, but not, 20, 30 years. You're still relatively new to the space when you look at some of the people that have been around for a long time. How have you acquired these business skills, and what do you struggle with from a business perspective as someone that's medical, having to look at things like financial statements, potentially thinking about the future of your business, where are you going to take it? Eventually when you've done everything you've wanted to achieve in aesthetics and you decide you want to move on, have you thought about that kind of stuff? Those are the main things that I'd like to know.
Yeah, so I early on understood that I'm a working mother. I have kids and a husband to be that is working a lot as well, because he's a criminal defense lawyer. So we both work a lot, but we still want to be present with our family. So we still don't want to rely too much on babysitters. I had kids to be able to spend time with them. So that's very important for me. So I knew that if I'm going to start a business, it's a very high risk for people in my age group and, type of situation to be burnt out. I know so many people. So I knew that from the beginning. So I tried to build a business model that was long lasting, that was going to be looking at it like a marathon, not like a short sprint. So I understood that to be able to do this, I need help. I'm not going to be able to do everything myself. It's just going to make me completely burnt out. So very early on, I hired admin people. So I've always put a lot of money in having the right staff. So I have one that is, my everything. She's my colleague. She's the manager. She takes care of all of the talks with the employees, all the stuff with our, injectors and staff and everything. She does basically everything. I have a social media full-time social media manager. I have a receptionist who's in charge of replying to all of the emails and all the messages and everything. I have a market specialist who knows how to read reports and to plan our financial future and to open new clinics. So I have staff that are extremely competent and that I rely on. And one thing that I've learned, and I've learned most of the things from my father, because he's always also had, he's started a very successful company, but without actually having any education before. So I've taken a lot of his strategies for business, and that's from him. I got the idea of the kindness, of being kind to your staff, being generous, because that's what's going to give you most in the long run. It's most efficient to be kind, because they're going to love you, and not by faking it, because I try to be a good person, and because they love you, they're going to give everything. And that is really what I'm seeing from my staff. They're really giving everything. They're loyal, they're good working. We don't have any problems, as I said. And I always try to think long term. So when I have this administrative staff that does almost everything, I never micromanage what they do. I never go in and okay, why did you do that and not that? I give them a problem, just solve it. I don't interfere in what they do. And that also gives them value. Okay, I have confidence, I can do it. I'm competent. And I really believe in positive feedback. And it's the same with my kids. If I just focus on the negative things that they do, if they do something wrong, maybe I'll say something, just a feedback, but very little. I focus on the positive. I believe in 5 times. If I just say something negative, I have to say 5 positive things to that person for them to be able to feel that they are good at what they're doing. And if they believe that they're good at what they're doing, they're going to be so much motivated in doing a good job. And it works. That's really my business strategy, and it's going really well, actually.
Excellent.
It is, business-wise as well. The numbers are looking perfect, so I'm very happy.
Excellent.
So you've got 2 clinics. What's the next step?
Yeah.
Do you want to scale more? Are you happy? Do you have enough time, energy?
I do. No, I do. I want to open more clinics, but that is difficult. It's difficult to know how to do it without losing quality.
Yeah.
Because it's very important to keep this. The way I do with my injectors, that I teach them everything. They work exactly, because what I promote on Instagram, I want all our clients to come and know what they get. It's not going to be that if they go to someone else than me, it's going to be completely different. It's going to be, Russian lips or something like that. So it's going to be the same. And that would be, if I would open in other countries or other cities, I would want them to use the same techniques as I do. And that is a little bit difficult because I don't want to lose the quality. So, but we're thinking about how to do it.
Yeah. Might have to promote from within. Maybe current employees become potential business partners in the future.
Yeah, that's definitely something that we've been thinking about.
Yeah, it's the easiest way to spread the right culture.
Yeah, but that's something, when you talk about becoming better, I would love to learn more about, scaling up, about franchising, about all of these things. Like, Felix Bertram, I think you had him on the show. He's just an inspiration for me when it comes to business and scaling up and stuff like that. Because I'm a doctor, I've been a medical student, I've never studied business. So everything that I do, I have to read up on my own. But I would love to learn more about those things, definitely.
Yeah. Shout out to Felix. Hope you're doing well, mate, if you're listening. I know he does listen. Here's, I guess, a simple question. You've already told us that consistency was probably your key for Instagram, but any other sort of specific tips for people who are pulling their hair out, trying to run their Instagram and grow it? I mean, we talk about the algorithm all the time, and yes, of course, it's changing, and it's not one thing that you can do, but, what are your top tips for injectors running Instagram?
Wow. I would say don't post pictures that are bloody and look very swollen. Because, it can still be a great job, but I put a lot of effort in, wiping everything, having a good lighting. And for example, if I take photographs of lips, I try to have them look aesthetically pleasant, even though the work is amazing. And if you look at the picture as an injector, you see that, okay, this is well done. But they are swollen and they're bloody. People are going to feel like, whoa, okay, I don't want to look at this. So that's like a mistake that I see people do, that they post very, swollen and bloody lips. Like, don't post it. Post something better that you have.
Yeah.
Or it's something, for example, take the client back after a few days, and when the worst swelling has gone down, and take a new picture. Yeah, but like, just to continue to do it. Like, I would say also read up a lot on the algorithm, because look at it as a science. It's not like sometimes people think, how hard can it be? But it's actually a science. If you don't want to read articles, there are a lot of accounts that you can follow with people explaining it, and with videos, they explain the algorithm, they explain what is a hook, what is a visual hook, like stuff like that. It actually does help. If you film with good quality, like lighting, you don't want to use a microphone. You don't want to film like without a microphone from your kitchen. It's not going to look good.
Yeah, it's terrible.
Because you're competing against such high quality videos now, or reels. So you need to keep the quality up.
Totally agreed. Now, we always end these podcasts with some sort of, I guess, recurring questions. I'm going to change one of the questions to a bit more of a broader question. So, excuse my language, what's your biggest fuck up in terms of, complications, and what did you do about it?
Oof. Okay, so I've had a few vascular occlusions. I've had 3 actually in lips. One was with sharp needle and 2 with a cannula. Because, as you obviously know, and everybody knows, a cannula has a lower risk for vascular occlusion, but definitely not a non-existing risk. So I don't know, I've read numbers like 70% lower risk. But I would say be careful when you're parallel to a vessel.
Yeah.
So all of my vascular occlusions with cannula has been in lips. So I've been parallel to the superior labial artery. And one, that was actually a screw up. One, it was a few years ago, but I didn't know whether or not, it was before I had ultrasound, I didn't know if it was a vascular occlusion or not.
Yeah.
I was thinking that it was just an arterial bleed. because I thought I hadn't pushed in any product. So I let her go home. And then she called me after I gave her my number, obviously, but then she called me after 2 days and said, this doesn't look good. So it was starting to get into stage 3 above her lip in the philtrum area. So then obviously I took her in immediately and I flooded everything with hyaluronidase, pulse, high doses and everything. So it had reached around stage 2 to 3. But then it took a few days, but it went back. So it was good.
Yeah.
And the other ones I've just dissolved immediately.
Cool.
So those are my, excuse my language, fuck ups. Yeah.
Yeah. So,
we've already asked that one. We've already asked your favorite conference. You said it was Needle Art, or that was the most recent one.
I really recommend it. It's really good, actually.
So if we ask the Injector Diaries question.
Well, hold on, that one.
I feel silly asking that question.
Why?
Okay. What's been your favorite IA podcast so far and why?
Yeah, I've listened to quite a few, actually. It's a very good podcast that you have. I really love the format and the guests that you've been having. One of my favorites is actually Tom Van Eyck.
Oh, yeah.
And that's because I really like him. I think I like his way of thinking, of being transparent, being honest. Those are qualities that in a person that I really like.
Yeah. He's
also very good at, posting other things as well, speaking up about, oppressed people in the world. I mean, I really like him as a person. So I would say that's my favorite episode.
Thank you.
Cool. Now, we end these ones with asking a question that our last Injector Diaries guest left you, which is Dr. Karim Syed. I'm sure you know Karim. Yeah. He's in your part of the world.
Yeah, I know him.
From Norway.
I know him.
I don't think it's actually that tricky a question, but if you had to subspecialize in aesthetics and only do one thing, what would it be and why?
What would you guess?
I think you're going to say lips.
Yeah, I would say lips or tear trough.
Yeah.
I'm actually very pro subspecialization. I think it's good in surgery, in general surgery, in GI tract surgery, and it's good in aesthetics as well, because if you choose something and you become an expert, it's just more efficient, I would say. So I'm very pro subspecialization. So I would say I'm already, I do a lot of Botox, I do all kinds of things, but I'm really good at lips and tear trough because I've analyzed it so much. I've broken it down into so many pieces. So I work in those two areas in a very, very detailed way, which I like. And that's also why I like it, because I love having a problem and try to see what causes these issues and how can I solve them. And also working with high precision, micro droplets, very, very detailed filler work. That's kind of my thing, actually.
Sounds like we might need to get Rebecka back for a masterclass episode on tear troughs.
100%. We'd definitely do that. Now,
I like to spill everything. So
yeah, great.
I can just,
Now, before we get onto our listener questions, because I gather there's tons, because we asked you to do a story and you had tons of them.
I didn't actually read them through.
That's okay. Yeah. We'll edit that out and just read through them. But you have to leave a question for our next Injector Diaries guest, and we have well, I probably do know who it is, but I'm not going to tell you who it is. But it could be anything you like. It could be philosophical, aesthetic, anything you like, just something that might make them think.
So my question is, I prepared a question. My question is there any time in your life that you have taken a chance, but you've been doubting whether or not you should do it before you took it? How do you look at that choice today?
I like that question.
Very good.
It's like a sliding doors moment.
Yeah.
Yeah. Do you remember that movie?
Yeah.
Yeah. No, that's really good. Trying to think. Yes, we do know who our next Injector Diaries guest is going to be.
That'll be interesting.
Yeah. All right. So we're going to ask you a couple of listener questions just to end this podcast, but we'll also add some extra listener questions because we've got so many as exclusive Patreon content.
Oh, excellent.
So if you're a patron, then you'll get access to that in the future. So question from Dr. Stephen Land. He's one of our regular Patreon sort of contributors. He's been on the podcast once before. Good guy.
He's a chief shit stirrer on our WhatsApp groups.
He definitely is. Bit of an internet troll on accounts, but no, I love him. He's funny. Do you do training for lips? And if so, can I come on it?
Yes, I do.
How does it work?
I do a lot of courses, and I would say my lip course, it's very advanced. So sometimes people come and they haven't worked with the cannula and lips before, and it's a little bit like too advanced for them sometimes. So it's good to come well prepared, like if you have a lot of experience, especially from working with the cannula. But it's very intense. It's talking a lot about like working in front of the muscle, how I do with the cannula, how I analyze the lips in terms of projection, in terms of the lower border of the upper lip, in terms of the surface, evening that out. And also, what cases do you want to work with, like behind the muscle? What can you achieve? And you can also work behind the muscle on the sides only, in the lower part, laterally only, lower lip, full lower lip only, or upper lip, full up. So many different variations for that. Also working in the philtrum area to get a flat, as flat of a lip as possible. So
cool.
It's very intense.
And is this all done in Stockholm in your clinic, or where do you do it?
Yes.
Okay, cool. Well,
but it's a long line. I currently have I think 80 people on the waiting list for the courses. So
fine. So if you want to do it, you better sign up.
Yeah.
Yes.
Well, you've just answered this one. This one was from Anne-Marie Cullen, who's also one of our patrons. Can you discuss your lip technique, please? Well, you've sort of explained a lot about that, actually.
Yeah. So it's basically analyzing the lip before, see what you want to achieve, and then,
Okay.
Draw on the lip and then inject.
Okay, this one's from Sherry Lee Noop. She is from Western Australia. She's one of our patrons, current president of the CNA, which is the Cosmetic Nurses Association here in Australia. So shout out to Sherry Lee. Hope you're well. So Sherry Lee says her markings for Tox are quite close together. What is she using? Is the diffusion very small? She also marks all over the nose. What is her purpose for this? Is it regular or patient specific?
So I think this relates to one of your recent posts, Rebecca, where you showed how you would do your own Tox. And I even noticed quite a few, particularly on the nose. So maybe you want to explain your markings and why the nose, so many points.
Yeah, so for the nose, basically what I want to achieve are two things. In short term, you will have lesser movements of the muscles of the nose, which will cause the flaring, I think,
dilation
of the nose wings. Sorry?
Dilation of the nostrils?
Yeah, dilation of the nostrils to become less. So when you smile, it doesn't, go out so much. And as a long term, like if I do someone's nose and then I see them again after 6 months, usually what I can see is I do see a little bit of a long-term thinning out of the muscle of the nose as well, in the same way as you do for the masseters. So this is the long-term effect.
Okay.
And it's actually quite efficient. I've definitely seen a lot of cases where the nose actually becomes a little bit thinner.
Do you not think it stings like shit to inject Toxin in your nose?
It's one of the worst areas that you can treat. I cry every time. It's so painful. It's even with a numbing cream, it's very painful.
You've got half Israeli, Middle Eastern skin. Do you have an oily nose with large pores like me? Do you find that it's better for the pores and the sebum?
Originally I do, but I love isotretinoin, so I microdose it, but so that's a problem in the past.
Fair enough.
So these are questions that Rebecca has sent to us from her listeners on her Instagram, her
story.
Her story, yes. Okay, so we picked any out here. We're going to go with all of them.
Maybe that one's a good one.
Okay, so this is from Do Gadam Mundes. Sorry, I have completely butchered your name. Apologies.
We can't actually see the whole name as well.
Yeah. So, question is, which treatment is best for double chin, in your opinion?
Double chin, it depends if it's only a double chin or if it's double chin and saggy skin.
Yeah.
So there aren't many really good non-surgical options for a double chin. I do use Kybella quite a lot, but I prefer actually Kybella for the jowls instead of the double chin, because in the double chin, at least in Sweden, it's a very expensive medication, and you have to do a lot of sessions to see a difference. So usually it ends up being more expensive than liposuction. So, and I'm very honest about that. I still have clients doing Kybella, and they're in their double chin, but I will be very clear about it doesn't tighten the skin at all. So whatever skin you have, it's going to be the same. Or if you remove large chunks of fat here, it's going to be loose skin. But that's basically the same as with liposuction. If you remove a lot of fat and you have a skin that is prone to being saggy, it can be the same problem, or it's a problem after 10 years, even though it's not a problem in the beginning. We do offer as well like face tight that we do in the double chin area. We have a doctor that is doing specialization in plastic surgery, so she does it. And we have another doctor that does it as well. So that is one option as well. Threads is possible if you want to tighten a little bit, but as I said, threads are a little bit 50-50. You don't know what effect you're going to have. So, and you can also do RF microneedling. We have Morpheus, which takes time, but it can be efficient. So usually what we do, depends on what level the patient wants to work in, and the age, but I would usually recommend doing face tight and then afterwards do some kind of tightening like Sculptra or something. I've done that and it's definitely an improvement compared to before. Absolutely.
Yeah, I think most patients, especially with slight saggy skin, it's going to be a multimodality. It's not one thing, it's several. Exactly. So yeah, you pretty much answered that. So this will be the last listener question, then maybe we'll tackle some more in our exclusive Patreon content. This is from Irina_Ventimilo. Does all filler migrate eventually and expand since it's hydrophilic? What are your thoughts on that? It's quite controversial.
Not everything. Depends on the area. Depends on the rheology of the filler, like how stiff the filler is. So there are many factors, or if it's an area that moves a lot. So if you use a soft filler in an area that moves a lot, there is a high risk that it's going to migrate. If you put a stiff filler in an area that doesn't move a lot, like for example, posterior temporal fossa, preauricular, I don't see migration. However, like in areas where it usually doesn't migrate fast, for example, in the mid-face, if you put filler on the bone, what can happen if you use filler a lot for many years is that it can start to change tissue levels and get into the SMOS, and then you can have this puffy feeling. So yeah, in some areas, in lips, I will say we can use strategies in order for the filler to migrate less. But if you do your lips, you have to take into consideration that at some point it is going to migrate. So dissolving around the lips is something that is considered normal maintenance of lip filler. That is what I say to my patients.
Okay.
Lips, nasolabial folds migrate a lot. It's very common. Tear trough can migrate, not always, but it can with time. So this is also something that patients need to know before they start with filler.
Fantastic. Well, that's been a great podcast. Really did enjoy that and to get to know you as well, Rebecka. Hopefully it wasn't too painful for you.
No, it was fun. I love this. It was really fun.
Less painful than nasal Botox.
Definitely.
Thank you again for your time. Hopefully we'll get to see you either here or at a conference, or maybe we'll come to Sweden one day. Any plans to travel and train abroad? We'll happily have you here in Australia.
Wow, I would love to come. That would be so exciting. Thank you so much for having me on this show. It was amazing.
Our pleasure. All right, well, take care of yourself and we'll speak soon.
Thanks, Rebecka.
Thank you. Bye.
For our latest news, follow us on Instagram at Inside Aesthetics Podcast. If you want to get in touch with myself or David, follow us on Instagram as well at Dr. Jake Sloan and David_Inside Aesthetics.
Join our Patreon for invaluable business and injectable education. Get access to our global community of like-minded professionals, live and interactive Zoom sessions, hints and tip videos, webinars, and more. Head over to www.insideaesthetics.com/Patreon for more information.